Well, I've had both knees replaced at the same time. I couldn't function properly. I walked like John Wayne, a lot of pain. So I was virtually in the end forced into it.
Well, it was about 5 or 6 years ago that I realised that my knee was beginning to, play up and be in a fair bit of pain, particularly since I played a fair amount of golf. I feel that if I didn't do something about this myself and get it moving, I would have struggled walking. I would have struggled. I'd got to a stage where I couldn't walk up a hill anyway very well. Even the pain at night at sleeping was pretty horrendous.
Well, it was initially because I tore the cruciate ligament, but once I had x-rays and went to see an orthopaedic surgeon, he pointed out that there was osteoarthritis, and to just repair the ACL was probably not much point, and he recommended that I consider having the total knee replacement.
Probably a little afraid in the beginning because a lot of people said the pain of the knee was, the operation was pretty horrendous. I sort of blocked that out of my mind and thought, well, it has to be done. It's got to be done. Get over it, get on with it and do it.
I was probably looking forward to the operation more than anything because I was in a lot of pain and I'd taken probably as many painkillers as you could probably take, and I didn't want to go down that path.
The benefit of having the knee fixed far outweighed any great fear I had.
Well, the surgeon took me through what would happen. I thought once the operation's done, I'd be pain-free and everything would be free and easy from then on. But he even said to me, look, you're not going to be 100%, not with your knees the way they were. You'll be much better, but you'll still have some pain.
It was explained to me that the progress is gradual but definite. So if you're looking for it to turn around in 1 month, 2 months, 3 months, you'll be disappointed and frustrated.
And he said to me, look, don't look short term. 12 months down the track, you won't know yourself.
The surgeon did recommend that I lose weight, and that was supported by the rehab team, who pointed out that every kilo in weight you lose takes approximately 3 kilos load off your knee. If I can try and get my body mass index, my BMI, a bit closer to what it should be, this replacement that's been done could last as much as 20 years.
Went to a heart specialist and she was the one that sort of put me on that path. You've got to diet, get some weight off you. And I didn't have another drink and I went on a diet and I got myself ready and did a lot of exercise. And I came into that operation at about 105 kilos and felt good. So I knew in my own mind I'd given myself the best chance.
You're being informed by a very highly qualified and educated surgeon. So if you ask every question that you can think of, and the questions are answered on one level intelligently but simply, and you are satisfied, you have a full understanding, then the confidence comes in that. And then only then can you sign off. And once I'd signed off, I didn't have second thoughts. I was ready to move forward.
I do believe that I was well informed and told every step of the way what was going to happen, particularly in the hospital area.
To have the charge just to tell me a couple of days before, this is what's going to happen, here's how we're going to look after you, this is what you're going to have to do here and there, it was good. I'm glad I went through it because I was ready for what happened from then on.